Over the last few years, our clinic has seen a huge surge in inquiries for the management of filler-related complications. Patients will typically have had their filler treated elsewhere around the country and internationally, but have found that it's almost impossible to identify a clinic with the right expertise that can manage the filler dissolving properly and also manage any complications that can arise from that. Having looked at the published medical literature, it became apparent to me very early on that we were seeing numbers far in excess of any other published paper on the subject of filler dissolving. This put us in a unique position to dig deeper and do some really intricate research into the nature of filler dissolving and the consequences of it. One particular area of clinical interest is what we call the post-hyaluronidase syndrome. And this describes patients having their filler dissolved and then feeling much worse off afterwards. And I'm now going to hand you over to Caroline, one of our consultants at the clinic, to tell you more about the paper that she led on.
What is the post-hyaluronidase syndrome? Well, if you Google hyalase, you'll find all these forums of patients saying that they've had their fillers dissolved with hyalase and it's left holes in their faces and dissolved their natural collagen away. And we wanted to do a study to find out, was there any truth in this? And we've actually just had this accepted for publication by Plastic and Reconstructive Surgery Global Open, which is a very high impact peer-reviewed journal. So what we did was we reviewed all our patients who have been dissolved with filler over the past 4 years, and there were 90 patients. And we categorised them as whether it was a satisfactory result and the filler had been dissolved, insufficient treatment requiring further treatment, or post-hyaluronidase syndrome. And what that describes is actually hollowing or pigmentary changes of the skin which were not there prior to the filler being dissolved. We found that 18% of patients describe this post-hyaluronidase syndrome. And why is that? So we are seeing an increasing number of patients with problems from filler. And what we do in the clinic is we offer them all a 3D MRI scan. And this shows the exact volume of filler in the face. We are finding MRIs with volumes of 30, 40, even up to 80 mils of filler. And patients are shocked to see this information, understandably, because they believe that that filler has dissolved, but that's not the case. And we are finding that filler is lasting a lot longer than people realised, especially the older types of fillers. Now, if hyalase is given, then people think their collagen is being dissolved away, when really it's actually that filler which is there, which is being dissolved away. And that's what our research found. We performed univariate analysis and found that the volume of filler injected and the duration that that filler has been there were both highly correlated with the association with the post-hyaluronidase syndrome. So now when I see patients in clinic, I can tell them, if you've had that filler in there only for a year or less and only in one area, dissolving it should not be a problem for you. But if you have had multiple injections of filler over many years, you are much more likely to develop the post-hyaluronidase syndrome.